7 causes of high blood pressure, and 9 natural cures that help. Do you often find yourself experiencing severe headaches, fatigue, tiredness, anxiety, or even nosebleeds? Then these may all be a sign that you have high blood pressure. Nearly half of all adults in the United States suffer from high blood pressure, also known as hypertension, which is a common condition that affects the body's arteries, causing the artery walls to expand. When you have high blood pressure, the blood's constant strain against the artery walls is too much. This means that for the heart to pump blood, it must exert considerably more effort. The increased effort of the heart pumping blood decreases the flow of blood and oxygen to your heart and can lead to heart disease if not treated. This video will explore 7 of the major causes affecting people resulting in high blood pressure. We will then look at some 9 natural cures that you can use to help prevent or treat high blood pressure. Please note that while everything in this video is based upon medical research, you should always consider seeking a second opinion to help. So, here are 7 things that can cause high blood pressure in people. Number 1, obesity. Overweight and obesity are defined as abnormal or excessive fat buildup that poses a risk to health. The body mass index, or BMI, is currently the most widely used indicator of people who are overweight or obese. Your BMI can be calculated based on your weight and height, and according to the Harvard School of Public Health, a BMI between 25 and 29 is considered overweight, while a BMI over 30 is classified as obese. According to studies, being obese or overweight increases the likelihood of developing high blood pressure. Studies have shown that people who engaged in regular exercise and lost weight experienced a significant drop in their blood pressure and risk of related disease. Number 2, smoking. Smoking temporarily raises blood pressure every time you do it. Smoking on a regular basis, and even exposure to secondhand smoke, increases the buildup of fatty substances known as plaque inside the arteries. The buildup of plaque in the arteries is a proven cause of high blood pressure. The nicotine inside of cigarettes is a major contributor to high blood pressure. It increases your heart rate and blood pressure and narrows your arteries, hardens the wall of your arteries, and increases the likelihood that your blood will clot. Furthermore, nicotine increases your risk of a heart attack or stroke because it strains your heart and is known to cause stress and anxiety in some people. Number 3, a high salt diet. The body only requires a small amount of salt each day to operate effectively. However, most Americans consume too much salt or sodium on a daily basis. Blood pressure can be increased by eating a lot of salt, and high blood pressure is a significant risk factor for heart disease and stroke. There are many foods that are high in salt that can be risk factors when it comes to developing high blood pressure, including ham, shrimp, cottage cheese, fast food, canned vegetables, pretzels, pickles, or biscuits. Numerous studies recommend that adults should eat no more than 5 grams of salt a day, which is less than 1 teaspoon. Number 4, alcohol. Alcohol abuse can cause blood pressure to rise dangerously. Blood pressure temporarily rises when more than 3 alcoholic drinks are consumed in one sitting. Alcohol use impacts the muscles surrounding the blood vessels. Drinking too much alcohol will cause your blood vessels to narrow, making it more difficult for the heart to pump blood through the body. According to a study of more than 17,000 American adults, drinking 7 to 13 drinks a week or more enhances one's risk of high blood pressure significantly. If you have high blood pressure, consider cutting out alcohol for a few weeks to see if it helps. Number 5, family history. A risk factor for acquiring high blood pressure is a family history of the condition. You have double the increased risk of developing high blood pressure if you or one of your close family members have it before the age of 60. A child's risk of having hypertension in the future is increased if a parent has high blood pressure, since the youngster may inherit the gene from the parent. Also, a family lifestyle that includes high blood pressure risk factors like smoking or an unhealthy diet may contribute to raising the blood pressure. Number 6, lack of exercise. It has been proven that a lack of physical activity increases the risk of cardiovascular disease and high blood pressure. Lack of exercise can make anxiety and depression symptoms worse. These illnesses can increase your stress, placing further pressure on your heart and increasing your risk of high blood pressure. Failing to get at least 30 minutes of moderate activity per day can increase your risk of developing high blood pressure due to a buildup of fatty plaque in the arteries. And lastly, the seventh cause of high blood pressures are medication. Certain medications have a potential to either increase the risk of developing high blood pressure or worsening it. It is vital that anyone taking regular medications check with their doctor to see if their prescriptions are safe for their blood pressure levels. Medications that are known to worsen your blood pressure include non-steroidal anti-inflammatories, some nasal sprays and eye drops, some cough drops, appetite suppressants, and the contraceptive pill. Liking this video? Before we continue to look at some of the natural cures that can reduce high blood pressure, please consider liking this video and subscribing to Vitality Health. And if you'd like to see more videos like this, do you have any tips for lowering blood pressure? Leave a comment below. Now that we know some of the major causes of high blood pressure, let's take a closer look at 9 natural cures that can help in lowering blood pressure. Number 1, exercise. Physical activity on a regular basis can reduce high blood pressure by a significant amount. To prevent blood pressure from increasing again, it's crucial to continue exercising. Aim for at least 30 minutes of moderate physical activity each day as a general objective. This can include walking outside or on a treadmill, swimming, riding a bike, working out in the gym, or yoga. Your heart becomes stronger and can pump more blood with less effort over time if you consistently increase your heart and breathing rates through the exercise. Your blood pressure will drop as a result of less pressure on your arteries. For older adults, studies have shown that even a light dose of exercise every day, such as a medium-paced walk, can help in lowering blood pressure. Number 2, reduce your sugar intake. According to some studies, sugar may impact your blood pressure more than salt. Consuming too much sugar can prevent blood arteries from producing enough nitric oxide. Nitric oxide aids in vasodilation, the process of enlarging blood vessels. Without nitric oxide expanding your blood vessels, your heart has greater difficulty pumping blood throughout your body. There are many foods today that are dangerously high in sugar. Some that you can cut out of your diet to help decrease your sugar intake are candy, cakes, soda, dairy products, pies, energy drinks, and gum. Number 3, eat dark chocolate. Dark chocolate has been shown in multiple studies to reduce high blood pressure. 1 or 2 squares of dark chocolate per day may help lower the risk of heart disease by reducing blood pressure and inflammation, according to multiple studies on the subject. It is important to note that the dark chocolate should contain at least 60 to 70% cacao. The flavonoids found in dark chocolate are contributed to lowering blood pressure. This is because flavonoids aid in blood vessel dilation or widening, helping blood to flow more easily throughout the body and thus decreasing blood pressure. Number 4, herbal medicines. Many cultures have harnessed the healing powers of herbs for centuries to treat a variety of different illnesses. Some certain herbs have the potential to reduce blood pressure. Before taking herbal supplements, always consult your physician or pharmacist, as they may conflict with your prescription drugs if you're taking any. Some of the best herbal medicines for lowering blood pressure include ginger root, black bean, celery juice, sesame oil, green tea, and tomato extract. Consume these herbal medicines in a tea, air diffuser, or in oil to harness their full effects in reducing your blood pressure. Number 5, garlic extract. Since ancient times, the vegetable garlic has been utilized to naturally decrease blood pressure. Both raw and extracted garlic are frequently used to help lower blood pressure. Studies have proven that taking garlic powder can lower your blood pressure by 9 to 12%. Number 6, high-protein foods. A large study conducted in 2014 found that people who consumed high amounts of protein had a lower risk of high blood pressure. Compared to people on a low-protein diet, those who consumed an average of 100 grams of protein per day had a 40% decreased risk of having high blood pressure. High-protein and natural foods that you can try include fish, such as salmon or tuna, eggs, beef, chicken, or for vegetarians and vegans, beans or red lentils. Number 7, meditation or yoga. Stress reduction techniques like mindfulness and meditation have been practiced and studied for a very long time. Yoga, which frequently incorporates breathing exercises, posture corrections, and meditation techniques, can also be helpful in lowering blood pressure and stress levels. Number 8. A good night's sleep. When you sleep, your blood pressure normally drops. Your blood pressure can be impacted by poor sleep. People who lack sleep, especially those in their middle years, are more likely to develop high blood pressure according to some studies. A regular sleep pattern of less than 7 hours per night or more than 9 hours per night was linked to an elevated risk of high blood pressure, according to the 2010 National Sleep Heart Health Study. If you struggle with getting restful sleep, try changing your environment, such as the room temperature, your nightly routine, the food you eat before bed, or stimulants such as caffeine, which keep you awake. The final natural cure you can use to lower your blood pressure is to eat more vegetables. Research has shown that having certain foods in your diet, especially those high in specific nutrients like potassium and magnesium, lowers your blood pressure level. A balanced diet is crucial for decreasing blood pressure and maintaining ideal levels. There are a number of foods you can include in your diet to lower blood pressure, including citrus fruits, pumpkin seeds, beans and lentils, berries and pistachios. That brings us to the end. If you enjoyed this content, please support us by leaving a like and subscribing to Vitality Health if you would love to see more content like this. Until next time, goodbye!